Hello, my name is Dr. Malcolm Gottesman. I'm going to talk to you today about some aspects of MS and lifestyle. First, I'd like to introduce myself. I'm the Chief of Neurology at Winthrop University Hospital, located in Mineola, New York, and I've directed an MS care center since 1997. Our center is actively involved in research, and we're also fortunate to have several dedicated nurses who are extremely helpful. MS is a chronic and unpredictable disease. There's tremendous variability in the course of patients with MS. Living with uncertainty can be very difficult. Certainly living with disability is very difficult. Unfortunately, there is no cure for multiple sclerosis. We have effective treatments, and they should be started as early as possible. But in addition to the medical treatments, which are essential to the treatment of MS, to fully enjoy life and have a meaningful life, one must pay attention to other aspects of living, which sounds silly what I'm saying, but I'm talking about emotional health, nutrition, exercise, lifestyle choices. These can be challenges for anyone, but particularly when someone has multiple sclerosis, they have to become conscious choices, and you have to try to make the best choices for you and the people that are near and dear to you. I suggest involving your family or significant other or loved ones as much as possible in explaining what MS is, explaining about this disease and its limitations and how it may affect you. It's important for your family to understand that some of the things that happen are not under your control. Fatigue, for example, is often a major issue for people with MS. And in order to deal with fatigue, it may be necessary to plan how you're going to use your energy. For example, rather than parking a long distance from a store and struggling across a parking lot, if you are having difficulty with leg strength, it would make more sense to use some sort of assistive device to get across the parking lot and save your energy for being in the store. And the same applies to any other activity that you may have. If there's something going on with your kids, to save your energy for that. And your family should hopefully understand and support your choices. It's very difficult to change your self-image. Most people who develop MS do so either as middle-aged or younger people when they really have no significant physical limitations. And suddenly you have to deal with these problems, which usually in the lifespan only come much later. I would definitely suggest supportive counseling and being in support groups. These are offered by the Long Island MS Society, which is an excellent organization and has much to offer in terms of support, emotional support, both for the patient and family members. There are also support groups for children. And education is very important. I'm going to touch on a few other issues. One is exercise. The saying, no pain, no gain, is not the model to use for physical therapy or exercise with multiple sclerosis. This is not a situation where you want a trainer to push you a little bit harder. With MS, it's necessary to do stretching exercises often, light strengthening, and not to exhaust yourself. Increased body temperature should be avoided, not because it's medically harmful, but it can worsen MS symptoms. So it would be necessary, for example, if you're going on an outing with your family, to try to plan it so that you don't do it in the middle of the day when it's at the hottest time, and even to get a wheelchair if it's needed, because you'll be accommodated very nicely in many places. It often takes a great psychological adjustment to see these adaptive aids as help. Initially, most people don't want anything to do with these assistive devices, and I try to help patients think about living whole, satisfying lives and to counsel them to look at these things as enablers of leading a more fulfilled life. The nurses we have here are extremely helpful also for helping patients. If we cannot do this type of counseling, we're quite interested in referring patients to therapy, either group supportive therapy, because if you do go to a group, you'll find you're not alone, and many people have the same problems, and the spouses have the same problems. So I think there is strength in numbers. Depression can occur with MS, both because of the fact there are sometimes limitations, and also MS is a disease of the brain, and sometimes there is a biological depression that occurs because the brain is affected with this problem. So there's no shame in it, and depression is extremely treatable, and we're quite liberal treating patients for depression with medications. Also, some of the medications we use to treat MS itself can increase the risk of depression. So if you feel you're becoming depressed, mention it to your doctor, and I think that there's no stigma in seeking treatment for depression, and it can result in a better life for you and your family. And I would also urge you to speak freely with your doctors about any difficulties you have. Living with MS is a challenge, for sure. We have better treatments that are coming out every day, and at the end of the day, no matter what happens, the trick is to live well. That ultimately is the secret. It's rare in medicine that we cure anyone of anything, of hypertension, diabetes, heart disease, but we want you to manage your MS rather than having your MS manage you. Thank you very much.